previous cases, meaning we do not yet have indication of widespread community transmission in the province. That being said, we should all assume that COVID could be anywhere, anytime, and act accordingly. As I said Monday, it's not the cases that we know of that worry us, it's the cases we do not know of. We know that in many jurisdictions in Canada and across the world, spread of COVID-19 in the 18 to 35-year age group is driving the surge in cases. There are several contributing factors to this. This age group is more likely to work in places where physical distancing is more challenging, and they are exposed to more contacts in multiple bubbles with family, roommates, and co-workers, and they are more likely to participate in gatherings than other age groups. So today, I'd like to speak directly to young adults in Newfoundland and Labrador. I believe you are an amazing force. I have watched with awe as you've created societal change with the Black Lives Matter movement, the LGBTQ rights movement, women's marches, climate change activism, and the anti-gun violence movement. My heart is filled with hope that our planet and society will be in your hands in the not-too-distant future. You have shown time and time again how much you care about this little blue dot spinning in space and all the creatures and people living on it. Today, I'm asking you to step up once again and be leaders and heroes in the prevention of COVID-19. You have so much to be proud of, and I know that you want to be able to say you did your part to protect the most vulnerable to COVID in our population. I understand how much COVID in the world right now seems out of control, and I'm with you in wanting things to be over and for life to be normal again. But wanting it won't make it so. There is so much we can all do to curb the spread of COVID-19, and the better we do it now, the quicker we can get back to normal. So today I'm asking you to control the controllable. I understand the inherent drive to socialize. Despite what these gray hairs are saying, I still remember that time in my life too. If you do spend time with others, please do it in a way that reduces the risk to yourself, your family, and your friends. Choose a small, consistent group of friends to spend time with. Choose places that are less risky and outdoor activities. Socialize with a small group of 5 to 6 close friends in your own home, ensuring physical distancing. Don't share food or drinks. Say goodbye, for now, to the bowl of chips, the plate of nachos, the party pizza. Opt for individual meals and snacks, either prepared by one person or ordered in. If you go to restaurants and bars, be sure you can distance yourself from others outside of your group. If you do interact with others outside of your usual contacts in public places, wear a mask and maintain physical distancing. Keep track of your contacts and download the COVID Alert app. These small changes can go a long way in reducing the risk of COVID-19 spread. We are asking anyone who has returned from Nova Scotia in the last 2 weeks and have visited bars in Halifax or the surrounding communities to call 811 to arrange for COVID-19 testing. This is in response to an advisory from Nova Scotia indicating that recent cases of COVID-19 have been among young people who have been to late-night bars and restaurants. I'm also becoming increasingly concerned about crowded retail establishments, particularly as we approach Black Friday and the lead up to Christmas. I know that there is some pandemic fatigue right now and people are becoming more relaxed in public spaces, but now is not the time to let our guard down. I cannot reinforce enough that a mask is only one layer of protection. It does not replace physical distancing. If you do shop, sanitize your hands upon entering and leaving the store. Stay 6 feet away from others. Respect directional arrows where aisles are marked as one way, and avoid crowded areas of any store. I strongly advise retail businesses to promote options to shop online or by phone and provide curbside pickup. Consider returning to designated hours for seniors and individuals with health conditions. Consider extending as opposed to restricting hours of operation to allow for fewer customers in the store at one time, and reduce capacity to allow for physical distancing. Last but not least, we are making improvements to how we manage travelers entering our province during the public health emergency. Until now, anyone who was not a permanent resident of Atlantic Canada or an essential worker would have to complete 2 different forms. one to see if they were allowed into the province, and another declaring that they would adhere to the 14-day self-isolation requirement and other public health measures. As of December 1st, our COVID-19 website and the travel form will clearly outline the reasons travellers are allowed to enter the province. We are making this change so it is very clear for travellers on whether they are permitted entry into the province before they leave their destination and what is required of them when they arrive. Travellers will be required to declare which criteria they are entering the province for, and they will be asked to complete the new travel form up to 30 days in advance of the date of their arrival. Upon completion, travellers will receive an email with a reference number that they will be required to present to border officials at their point of entry. I want to reinforce that travel at this time should only be for essential reasons. Newfoundland and Labrador is still in a public health emergency. If your circumstance does not fall into one of the approved criteria, but you still feel your travel is essential, you will still need to apply for a travel exemption. We expect that such instances will be low. Another enhancement to the travel process includes requiring essential workers to identify the sector they are affiliated with, their worksite in the province, and their employer's contact information. Employers of essential workers may be contacted to ensure the work being carried out by the individual is indeed essential. As a recap, for those who may have just joined us, we have one new case since yesterday's media advisory, and the total number of cases in our province is 324. We are holding steady. We have the tools and the ability to keep COVID-19 at bay. Let's stay vigilant, strengthen our defences, and look out for one another. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Some very important information there from Dr. Fitzgerald and her team at Public Health. Dr. Fitzgerald's skillful guidance and incredible dedication, along with everyone working in the health system, including our own Minister, Dr. Haggie, are helping us navigate the COVID-19 pandemic. Thank you to you all. To the people of Deer Lake and Grand Bank, please know that we are doing all we can to stop the spread of COVID-19 in your communities, but we can't do that without your help. Your extra vigilance is needed at this time. To the children in Deer Lake who have been out of school for the past few days, this part of my message is for you. Trust what your parents, guardians, teachers, and principals are saying. We know that this is tough. My wife and I have young children, and we understand it's not easy to follow all these extra rules, but it's so important that you wash your hands, wear a mask, and to keep safe distance from your friends who are not in your bubble. Think about how that will help protect people like your aunts and uncles and your grandparents, the people you love. I know you may be scared or even frightened. And you know what? That's okay. Talk to your family, your teachers, and your friends about it. You are not alone. If we do this for just a little longer, together, we will get there. My friends, just yesterday, our neighbors in Nova Scotia reported 37 new cases. Premier McNeil and Chief Medical Officer of Health, Dr. Strang, announced Halifax area restaurants, bars, fitness, and recreational facilities are closed to in-person services for 2 weeks. And people from here who over the past 2 weeks visited bars and restaurants in the Halifax area and are now back in our province should call 811 to arrange for testing. We are doing this out of an abundance of caution. Newfoundland and Labrador, I'm going to put it to you straight. We don't want to have to close our businesses here. We want to protect the freedoms that we've come to enjoy while in line with public health measures, of course. We want to avoid a full lockdown that we're seeing across the country. We want to ensure that the local economies can continue to operate as much as possible. I've said it before, and we'll say it again. We will get through this. That's why it's important to practice those health guidelines so that local companies can remain open and the people they employ can remain on the job. Temporarily changing the Atlantic bubble is one way we hope to do that. 14 days of proper self-isolation is the proven gold standard, most effective way to reduce the spread of COVID-19. And we need to reduce it. Newfoundland and Labrador has an older population, and we can't afford to strain our healthcare system. This is why it's so important for every Newfoundlander and Labradorian to listen to public health guidance and follow the rules. I know it's a lot to ask, even more to deliver. But throughout the COVID-19 pandemic, you have done what Newfoundlanders and Labradorians have always done. You have risen to the challenge, shown your resilience. You have persevered. No group of people has done this more than our rotational workers and their families. I've heard from some of you, and I heard about how you feel bad coming back from the 2-week stints where you were working hard to support yourself and your families. We know it's tough on you and everyone around you. Unfortunately, we need to ask you to keep it up. It's been said over and over again, but we can't say it enough. People need to be kind and patient. For 8 months now, those on the front lines of the COVID-19 pandemic have been working around the clock. We need to show our gratitude and be understanding of each other. Focus on mentally and physically, being well, to be the best citizen you can be in these tough times, and serve your province in your own special way. It doesn't help anyone if people are hesitant to come forward to get tested or hesitant to disclose their contacts. This is why downloading the COVID-19 Alert app is such a huge help, as is getting your flu shot. The end of this year is closing in. A month from today, in fact. It will be Christmas Day. With that in mind, as you purchase gifts, please shop local. Now more than ever, the hardworking individuals running local companies and businesses, thank you. I'll now pass it over to Dr. Haggie for his update.
Thank you very much, Premier. One new case, a different number than we've had for a few days now, and a trend in the right direction. Speaking of numbers, last night I spent a considerable period of time on the phone with a conference call of the health ministers from across Canada, talking about both the situation in their own home jurisdictions as well as plans for vaccine rollout for those vaccines that finally make it through the cut, as it were, showing both efficacy and safety. We spend a lot of time talking about metrics and measures. We have always looked at numbers and rates. One of the rates we have not broadcast, which is actually very telling, is one that Saskatchewan and Manitoba have started reporting, which is their test positivity rate. What that means is the number of tests in a day or a period of time that they do that are actually positive versus negative. This number, ideally, for public health purposes, to show the adequacy of testing and adequacy of contact tracing and identifying cases, should really be below 5%. Saskatchewan and Manitoba are running between 8 and 10%, and there are areas in Alberta where they simply can't calculate it accurately. We, on the basis of our day-to-day, for example, are running at about 1/4%, which suggests that not only do we have adequate capacity for testing, we also have contact tracing that is working well. And again, I would join the Premier in thanking Dr. Fitzgerald and her public health team for the prompt responses we've seen as cases have popped up. We've seen across the province, and we discussed last night about other jurisdictions' measures, and I think Alberta is now one of the last to adopt measures that we've had in this province for several months now. I think that is one of the reasons why we have been relatively well insulated thus far. We did talk as well about information sharing. One of the challenges we have with people traveling from work sites across the country is outbreak notification. We rely on the Public Health Agency of Canada, and they are actually very prompt at notifying us. Their challenge is getting the information from places such as Alberta and Manitoba in a timely way. The thing that worries me is not so much the ones that may have ended and we don't know about. It's the ones that neither we know about nor the employees at the work site, because they haven't been notified either. And I drew people's attention to that last night, and I have an undertaking from Minister Haidu that this will be addressed. We spent some time talking about vaccine and its rollout, and I think we are getting to a place now where we'll soon know the numbers that will be available to us, assuming both Pfizer and Moderna and their new vaccines get approval. That's not a given. On average, 2/3 of vaccines that are trialled never make it to safely be distributed to the public. That's a very important figure in terms of maintaining the health of the population, but it's also a challenge when we're looking with eager anticipation towards the arrival of a vaccine. So the answer at the moment from a vaccine point of view is that we have to continue to rely on the things that the Premier has emphasised and the things that Dr. Fitzgerald has been telling you since back in March. The other topic of discussion was around how provinces are taking these measures in an effort to provide safe schooling for our youth and our children. Again, comments today from our own child youth advocate showing that schools are a safe place and concern about absenteeism, particularly that which is driven by maybe misinformation or social media rather than information from the regional health authorities or Dr. Fitzgerald and public health. The other challenge around that has been with the kindness element, quite frankly. There is a sea change in my own social media from earlier on, and there are expressions of goodwill towards people who have COVID-19 and their families. And the proportion of comments that are not sympathetic have reduced. However, to compensate for that in some perverse way, they have become nastier and more malicious, bordering, in my view, on cyberbullying. And I think really it is a testament to the vast majority of Newfoundlanders and Labradorians that we haven't sunk into that cesspit, but some obviously have. Noting the changes that were announced around essential workers from across Canada, Newfoundland and Labrador workers that have travelled to the Atlantic bubble will now have to self-isolate in exactly the same way that they would if they came back from Manitoba or Ontario. So that means that they must self-isolate when not at work. Their families, however, are free to undertake regular activities. And again, I would encourage their children to go to school, and I would encourage schools and their classmates to accept them in the way that a lot of people have. As Dr. Fitzgerald says, we're all sitting here wanting things to be different, but wanting and wishing will not get us there. We have to act. We have done so well so far, and again, you know the things that we have recommended that will make a difference. On their own, not one of them will protect you by itself, but taken together, they're like the layers of a laminate screen, way stronger together than any one layer is on its own. And I would encourage you to heed and adopt as many of those as possible. So with that, Premier, I will take my piece and throw it back to yourself.
Well, thank you very much, Minister, and we'll certainly now open it up for questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any final questions. Our first questions today are from Peter Jackson with the Telegram.
Thank you. You said last week, Minister, that and Premier, that you don't have a firm answer on whether vaccines will be distributed on a per capita basis. Are you any closer to an answer on that now?
Well, we're still, this is, again, not a straightforward yes or no or formula-based answer. There are multiple variables that have to be weighed, and these are decisions that are being made across several different tables across the country currently. And of course, the Minister can comment on his most recent table, which was last night, and I'm joining a call with all the other premiers from across the country tomorrow, and I'm sure that will be a heated topic of conversation. Minister, I'm not sure if you want to add anything else.
No, I mean, I expressed the view that I felt that, as with a lot of things distributed by the federal government, we in Newfoundland and Labrador should get a share that is weighted to reflect not only just our population, but the level of chronic disease burden and the fact we have one of the oldest, if not the oldest, population by proportion of seniors. I think, very least, we have to have it based on population to some extent. Whether or not that weighting argument carries and to what extent, I think, is not yet clear.
And of course, we need to remind everybody our jobs up here are first and foremost to protect Newfoundlanders and Labradorians, and that's what we do at all the tables that we all collectively sit at.
Okay, thank you. And one of the questions I get personally as well as a reporter, and I'm sure you do too, involves rotational workers' families. There are constant pleas that these families, the spouses, the children, should not be in schools, should not be in businesses. How do you answer the constant fears about that situation?
Well, there's fairly strict guidelines on rotational workers coming from outbreak areas, and it deserves repeating. So I'll pass it over to Dr. Fitzgerald to have further comments.
Yes, so if, if a rotational worker is coming from an area that's not in outbreak and they're asymptomatic, so they don't have any symptoms, then they and their family are permitted to isolate together, and the family are still permitted to attend their school and work. Obviously, if any symptom develops, that's a different situation, and then everybody has to self-isolate. And testing, obviously. If you're coming from an area that's has an outbreak, so if you're coming from a camp where there's already a known outbreak, then those rules don't apply, and the rotational worker is supposed to isolate away from their family in the same way that anyone coming back into the country, into the province, would have to isolate away from their family. So they could either be in a different place, in a different house or cabin or something like that. Or if they're in the same house, they would have to be in a part of the house that was completely separate, preferably with a separate bedroom and bathroom, and they wouldn't be able to share common spaces within the house, be in those common spaces at the same time, preferably have their meals delivered to their room, that sort of thing. So we would expect, if they were coming from an outbreak site, which brings with it the higher risk, that there would be increased separation. We have to remember that a lot of these camps where workers are have put a lot of protections in place to prevent the spread of COVID-19 throughout that camp. So even if they get cases there, there's still a lot of protection in place to prevent the spread beyond those first few cases. This is, we're looking at a select group of people. We're looking at a situation that's slightly different than just traveling through other areas of the country. And we have to also take into account the impact that constant isolation essentially would have on their mental health. This is, it's a difficult situation. We're trying to reach a balance, and I think everybody has to remember to be kind and to put yourself in someone else's shoes.
And we have shown, I think, that when people do follow the rules, and almost always they have in the past, this system, this protocol that Dr. Fitzgerald has established has worked. But that said, we're incredibly empathetic and sympathetic to the turmoil and that this must cause in individual families, and it's the unfortunate reality of life with COVID-19 and traveling for work. We are always reevaluating our protocols and looking for ways to change things, but currently I think that we have shown in the past that the protocols that we have put in place have been quite effective.
Richard Duggan with VOCM, please go ahead.
Thank you, Premier. At the COVID briefing on Monday, you talked about how point-of-entry testing isn't considered to be effective and that it doesn't really achieve what the government would want it to achieve. Why are workers at the Muskrat Falls site then required to get COVID testing before they head to that work site?
Well, individual employees have their own protocols in place, and so that's for each business to determine. But point of entry testing, referring to people entering the province, is not been shown to be effective in isolation. I would welcome other evidence to that effect, but certainly there's none that we've been able to gather that would support point of entry testing and isolation. Certainly, again, it's worth repeating that it's the 30% false negative rate that's upsetting and can lead to the community spread of disease, give a false sense of security, and 3 out of 10 then therefore would travel, potentially spreading COVID-19 in the face of what they would think would be a negative test. So this is what we determined on the evidence available to us currently to be the best approach.
What about random rapid testing? It's being used now in Ontario and Nova Scotia. Would we consider that here, or do our current self-isolation and contact tracing measures suffice?
Well, I mean, I would assume those 2 areas that you referred to have significant community spread currently, and there's different kind of testing protocols when you see some of that. But I'll turn that over to Dr. Fitzgerald for a more technical explanation.
So rapid testing, certainly we have seen it being used in some other areas in the country. And it is something that we are looking at right now. As the Premier said, community spread certainly is generally happening in places where these are being used, and would certainly make them more useful and more reliable as the results of the tests more reliable. But it's something that we are looking at. We do have access to rapid tests, so we want to make sure that we're using them properly, that we're using them where we need to be using them, and that they can give us the best information possible, like we have with every testing modality that we've had up to this point.
Thank you.
Our next questions are from Peter Cowan with CBC.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
Not because of any positivity or anything like that, but just from technical reasons. And we've had no positives in that group.
And can you give me an idea of how many people have had to isolate from that elementary school, and give me an idea, I guess, the level of exposure by having that one person who tested positive?
So in the school itself, you would have the cohort of children plus the teachers and any other teachers that they would have come into contact with. And then anyone who they may have had contact with outside of the school. As with any case, we would do that close contact tracing. But I don't know the exact number that are in isolation as we speak, but it would be likely over 30 at this point.
Okay, thank you.
Kellyanne Roberts with NTV. Please go ahead.
Thank you. I'm looking to clarify on Monday's announcement about the bubble closing. For some in Newfoundland and Labrador, if they're traveling to other parts of the province, so St. John's and Deer Lake, for example, they're having to do a layover in Halifax. I'm just looking to clarify, does this mean they'll have to self-isolate for 2 weeks because of the layover?
No, so we've that's happened in other situations before now, and certainly we have not. If they're traveling through an airport just to get to another area or province, then they don't have to self-isolate.
Thank you. And today, when you talked about the singular form, now that'll happen beginning December 1st. For those who have already received exemptions and say are arriving here on or after December 1st and have already been given exemptions, do they need to reapply and go through this new process?
So my understanding is that they would not, but I'll certainly verify that for you, Kellyanne.
Thank you.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador.
Thank you. Ontario just tapped retired General Rick Hillier to lead its vaccine rollout team, and I'm curious, will your government do something like that soon or make an announcement on that?
Well, we're evaluating, again, with different conversations at different levels, the evidence of the vaccine and what the likely distribution channels will be. And Dr. Fitzgerald and her team have been leading that to date, and we're still looking. Again, this is evolving information and will change, so I'd never kind of want to give you misinformation as the scope of the landscape changes, but we're certainly looking at all options available to us. And again, I want to reassure everyone at home, the three of us, and in fact your entire government is top priority is your public health and safety and getting that vaccine so that it can be distributed in Newfoundland and Labrador, starting, of course, with our most vulnerable, is the most important top priority that we're bringing to the table right now.
Thank you. And on Monday, you mentioned public health officials needed time to get the logistical issues set for leaving the bubble. Dr. Fitzgerald, can you tell us what those logistical points were?
Sure. So we had to look at how we would change our screening criteria, our declaration forms. We had to look at symptom screening forms, for school and things like that. So, and then we had to develop criteria for the exceptional circumstances or extenuating circumstances that people could avail of, and work with the RHAs to make sure we had everything in place with regard to any testing that may be done. So there was a few things to work through.
Thank you. Our next questions are from Patrick Butler with Radio Canada.
Hi, and just before I go on, someone seems to have their volume on, so we're hearing some ringing on the line. If someone could put themselves on mute, so just
I'm
for
glad
those
you
of us
said
who are
that,
going to
Patrick.
use
I was thinking it was in my head.
I'd like to ask about the process for earlier this week. It was mentioned there's a process for people arriving from the other Atlantic provinces during this 2-week pause for them to be able to apply to get an early test and maybe get out of quarantine earlier than the 14 days. Could you explain how that process is going to work?
Yes, so people will apply through the exemptions email, and that's on our website. And they can ask if there are a couple of extenuating circumstances that we've identified that would allow people to be able to avail of that testing. And so that information will be on our website.
And I'd just like to ask a question about the school cluster or the issues in Deer Lake. There's been talk of very few students attending junior high and the high school because of the cluster in that community. How prepared are schools in that area to deliver online education if we continue to see not a lot of people showing up for class?
Well, first of all, I think what we've proven in the last 48 hours is that the protocols work. So isolating a cohort, I think that people should be reassured that isolating cohorts within schools work, and it will allow, a continued orderly, calm approach to education and life with COVID-19. But there are online tools available should and perhaps when COVID issues occur in throughout schools. That wouldn't be unique to any particular area because it's been distributed through the Department of Education and the school districts. So, that should be available, and perhaps best to follow it up with Minister Osborne, but certainly those materials are available.
And now we're back to Peter Jackson with the Telegram.
Hello. I do have another question. I wanted to clarify the new rules. I believe it's for essential workers. You say that there's a 30-day in advance, a need to apply 30 days in advance for this. Is that going to be a problem for people who are needed on a much shorter notice?
No, so they can apply up to 30 days in advance, but it doesn't have to be 30 days in advance. We would prefer if it was done at least, around 72 hours in advance. That would give people time to make sure they get everything that they need, but it can be done right up to the time that someone arrives in the airport, really, I guess, as long as they fall into one of those exemption categories.
Okay. No, I had another question that Patrick asked us, so that's fine. Thank you.
Richard Duggan with VOCM, please go ahead.
Thank you. I have a question about young children who have to self-isolate. We saw that case earlier this week at the elementary school, and because of that, some young children would have had to go into isolation while they were waiting for their test results. And Dr. Fitzgerald, I believe, mentioned it earlier, how if, say, we have an adult who tests positive or has to isolate, they're told to stay away from the other people in their household, kind of section themselves off in a section of the house if at all possible. But when we're dealing with children, say in that situation earlier this week, who are 5, 6 years old, who need to isolate or, God forbid, test positive, that's not that simple. There's a needed interaction between parents and caregivers that you just can't avoid when you're dealing with children that are that young. So what advice do you have for parents who may find themselves in such a situation where they need to have that interaction but want to do the best they can to make sure the rest of their household stays safe from the virus?
Yes, so, certainly if it's possible to have the rest, you designate one parent that can care for the child. Obviously, we don't expect that the child's going to be able to care for themselves in that situation. So, it's a given that a parent will have to spend time with that child. That parent will then have to isolate along with that child, obviously. And then if the rest of the family can isolate away from the child who's tested positive, then, obviously that's ideal. If not, then we try to separate as much as possible within that household. And in the same way that I spoke about earlier, having a separate bedroom, bathroom, getting meals delivered, that sort of thing. If that's not possible, then I guess the whole family will have to isolate. Within the house, though, you can take precautions within the household, trying to physically distance as much as possible. Wear masks if you have to come into closer contact with each other. And even for the parent who's the caregiver who may not be positive, wearing a mask can certainly help when you have to do things up close. So those are all things that you can do. Washing your hands, of course, very, very important. Make sure you wash your hands very well. And practice good cough and sneeze etiquette as much as possible. Although, we recognize that with very young children that sometimes can be difficult.
Thank you. And I was just wondering, where we're pushing the flu vaccine and we're trying to avoid that double pandemic. I was just curious, have we had any confirmed influenza cases in the province?
None so far this year, thankfully. But the majority of our flu starts around late December and really is into January. So we wouldn't be expecting to see a whole lot at this point. We would be expecting to see some, but generally it's a little bit later in the year when we see the most cases. But, some of what we're doing to help protect us against COVID can help protect against the flu as well. However, we still would recommend that everybody get their flu shot. There's still lots to be available, and you can still get appointments or go to your pharmacy or to your family physician.
Thank you.
Peter Cowan, please go ahead.
Thank you. Question about point-of-entry testing. I talked to Dr. Merrick Smeha, the head of McMaster Health Labs. They've done the largest study of point-of-entry testing. He says it is useful even in conjunction with quarantine. For example, if 70% of the people who are going to test positive know that they actually have it when they enter, they're going to isolate away from other people, and it could avoid situations like we saw in Grand Bank or Deer Lake, where people coming in infect their families because they don't realize they have the disease. why aren't we incorporating it not as a instead of quarantine, but as a with quarantine measure?
So we can all comment on this, I suppose, but it's the evidence of that study hasn't been fully released yet from McMaster, and they're a great research group. Don't get me wrong, but there are preliminary results, and we look forward to kind of seeing the results of their study. We also kind of looking forward to seeing the results of the Alberta study, who's testing the point of entry tests as well in much greater numbers in conjunction with the federal government's support. The point of entry testing and the probabilistic modeling that we've been looking at shows that point of entry plus in isolation obviously is not good, because you have the 30% negative predictive or the false negative, sorry. But if you compare the two tests to just the test on day 7, so if we have a point of entry and a point of exit, but if you compare it with the point of exit alone, those results are fairly similar, and in fact they're almost identical. So the point of entry, we're concerned, may cause a false sense of security, and therefore cause extra disease spread, which wasn't really reflected in the McMaster study to date. But Dr. Fitzgerald, I'm not sure if you're probably able to. And I will add this, sorry, before we turn it over. We do plan to have a technical briefing on point of entry testing later in the week to help clarify certainly the evidence that we're using to make these decisions.
Yeah, and the other thing we have to remember about point of entry testing is that if you have people who aren't isolating away from their families, then yes, it does help them to inform. But everybody coming back to the province, with the exception of rotational workers, our isolation recommendations right now are that they do isolate away from families regardless. So if people are following the guidelines appropriately, then they already are isolating away from the people in their families or in their households. So I'm not sure of the value added in that situation.
Yeah, I think we all agree that we're trying to, and everyone across the country is trying to shorten the quarantine period from the 14 days to as low as we possibly can. And the added value of the point of entry versus the point of exit, I'm not sure is valuable at this particular moment in time.
Dr. Fitzgerald, just to follow up, though, we have seen in Grand Bank and we saw in Deer Lake, people came into the province and they were able to spread it to their family members. So isn't that evidence that the measures we have aren't preventing the spread to other family members and then into other people in the community?
So I think we have to consider the number of people who have come back and have not spread it to their family members. So, we have to remember that. And no system is going to be perfect. But as I've said before, we cannot create policy based on one or two specific examples or one or two, cases. So we have to look at the whole picture and decide where is the best use of our resources that will give us the best information and provide the best protection.
And correct me if I'm wrong, Dr. Fitzgerald, but in those scenarios, the rotational worker protocol wouldn't have applied anyway, so that they had to self-isolate for 14 days.
Yes.
Kellyanne Roberts, please go ahead.
Thank you. How many people have identified themselves as travelers who are in Nova Scotia and have now called 811 for testing since the announcement of the bars and restaurants after 10 p.m. in Halifax?
I don't have that number. We did see a spike with 811 at the beginning of the week, but that was associated with the cluster in Deer Lake and seeking advice. It might actually be quite difficult to go back and identify which travelers came from within the bubble specifically who rang, but we can certainly go back and get you some numbers that we do have, and I'll see what we can organize for you.
Thank you. As well, there seems to be a lot of questions and misinformation about needing to self-isolate if you're returning from outside Newfoundland and Labrador. So it's as of 12:01 a.m. Wednesday morning. From that point on, you need to self-isolate. If you arrived at 11:58 Tuesday night, you don't have to?
Yes. It starts at 12:01. We had to take a cut-off, and we've done this before with changes. Some people fall on one side and some on another, but 12:01 is the cut-off.
Thank you.
Elizabeth Witten, All Newfoundland Labrador. Please go ahead.
Thank you. I was wondering if you could walk us through the decision to return to 3 briefings a week, because it's been a while since that happened.
Well, we thought it was prudent that we increased the frequency of the briefings just with the change of being withdrawn from the Atlantic bubble or a bubble within the Atlantic bubble for the next 2 weeks. And I know there's a great deal of anxiety across the province as we've seen pockets and clusters occur in Deer Lake and Grand Bank. And of course, the TV is always on and people are hearing the outbreaks around the country. And so we felt like this was a good idea to provide a calm, a collective approach and to give some reassurances to those at home that we're doing our very best to control COVID-19 from coming in, and if it is in, from preventing it from spreading.
Excellent. And I'm curious if we can get an update on our PPE status as well.
Certainly, the PPE, we're aiming for 180 days in the supply chain within the province at pandemic burn rates. My last information was that 80% of those orders have been placed and 60 plus, nearly 70% have been reconciled and fulfilled. So we're in a significantly better place than we were earlier on, and our position continues to improve with every delivery.
Excellent. Thank you.
Patrick Butler, please go ahead.
Hi. My first question is related to the Atlantic bubble. The fact that there was 37 cases reported in Halifax. What is that? How does that bode, I guess, for this being a temporary 2-week pause for the Atlantic bubble for Newfoundland's participation?
I think it's a bit premature to fully evaluate the numbers, but obviously, we were concerned, not again to reflect on Monday's announcement. It wasn't just the absolute number that was involved in different jurisdictions. It was also the reality of community spread there, and we'll be watching the numbers carefully, but those will be the kind of variables that we'll certainly be considering and reevaluating as we go closer to the 2-week trial of this suspension from the bubble.
And you mentioned this previously. There's a heck of a lot of rumors going around about cases being in certain places. People on social media, maybe stoking fears. And if you're a parent, I guess what's your message to a parent who's hearing that there's a case in their community, who finds himself in that situation, and they're wondering, is it safe to send my kid to school? When I'm looking at public health and I'm not hearing that same information.
Yeah, sure, of course. I mean, I have young kids at home, and I would feel the same anxieties. But what I would say to parents in that situation is stay calm. And Dr. Fitzgerald and her team have shown and proven that they're able to execute real protocols in real time that protect Newfoundlanders and Labradorians. And I think they should take some comfort in that, a lot of comfort in that, in fact, that the public health officials here are the envy of the rest of the country, and they have the results to prove it. So I think, whenever a child is ill or has an illness in any case, whether it's a cold or a significant illness, of course, as parents, we all feel that deeply and personally, but just be calm, and public health officials will be in contact with you if they need to. If you don't hear from them, then your contacts didn't need to be traced. And if you're fearful and you feel like your child is developing symptoms, then always reach out to 811 and seek advice.
I'll now go back through each reporter to see if there are any final questions. Peter Jackson, do you have any questions?
No, I'm good, thank you.
Richard Duggan?
I'm good, thank you.
Peter Cowan?
I do have a couple. On the southern shore, we saw one school there where almost all the parents decided to keep their kids home because they were afraid that a family of a rotational worker wasn't following what they considered best practices. What does this say about the level of confidence right now parents have in the education system with the fact that their choosing in large numbers there and also in Deer Lake to keep their kids home, even though the schools are open and public health has said that it is safe?
Well, I mean, you know, I can't speak to individual families there, but the protocols have shown that they've worked. They've shown, Dr. Fitzgerald has shown now in the most recent Deer Lake example that the protocols did work and the cohorts of schools did work, and they put a lot of time and effort and research into developing these protocols. So, you know, while there is this fear and anxiety as cases grow across the country, and we're seeing it on our shores and in our own backyards these days, these protocols are in place for a reason. And we've shown that they can work in the past, and I believe and I know we've shown that these will work in the future, and it's a dynamic situation, and we need to be flexible. So, you know, if there's one case of COVID somewhere in the province, doesn't mean that all the schools will shut down. We need to have that flexibility and that dynamic approach that allows us to meet the dynamic changes that do occur with COVID-19. And so I think, you know, people are not sending their children to school. I think, you know, they should pause and take a deep breath. And I understand their anxieties, but they should have every confidence in Dr. Fitzgerald and her public health team that have proven, that have earned their stripes, that they implemented these protocols with the safety of the children as the #1 priority.
And I just wanted to get your reaction, Premier, to the announcements that we saw in Alberta yesterday about the measures they're bringing in. The cases that we see here are quite closely tied with Alberta. So what's your reaction? Some people have said Mr. Kenney didn't go far enough in bringing in measures to try and control the spread there. What do you make of their announcement?
Well, you know, it's never good, and first of all, my empathy and sympathies to those suffering from COVID-19 in any province, and in particular, almost our sister province of Alberta, as we know that there's so many of our loved ones who live there, and I wish them all the speediest recovery. But Premier Kenney took the action that he felt yesterday he needed to take. When we were evaluating the Atlantic bubble and our position in it, and frankly our position across the country, we were looking at this epidemiology, this community spread, the volume of cases, the ICU capacities across the country, and these are some of the variables that were included in the decision matrix to suspend the bubble, recognizing that Alberta and Nova Scotia and New Brunswick are some of the largest sources of travel to the island and to Labrador. And so this is why we weighed all of this and came to the conclusion that we did in order to protect the businesses and the economies and keep the schools open currently, to enjoy the freedoms that we have been enjoying in Newfoundland and Labrador despite COVID-19 being on our shores.
Thank you.
Kellyanne, any final questions?
Yes. With the briefings now going to 3 days a week, are we going back and remaining at this time of 2 o'clock for all of them?
Yes.
Thank you. And in regard to the flu vaccine, obviously we've seen the effectiveness of it along with the other public health measures that we're all following. I'm wondering what the effective rate of the vaccine is, though. I know we're hearing other rates when it comes to vaccines. For example, Pfizer of 95% and Moderna and all these other rates. I'm just wondering what our flu vaccine effectiveness rate is.
That's a
flu vaccine?
Loaded question, yeah, for sure.
Flu vaccine, is that what you... So we don't have that information right now. That usually gets developed over time as we see the amount of flu that actually comes into the country. And so once we start to see cases tick up elsewhere, then usually we can make an assessment about the effectiveness of the flu vaccine. But I think this year we've not been seeing a whole lot of flu anywhere. So it's probably a bit premature to be talking about that yet.
Yeah, Kellyanne, that's not unique to Newfoundland and Labrador. The flu vaccine, of course, is a predictive vaccine, so it's a best guess. And so this would be the same scenario if you asked this question in Alberta or Toronto or BC or the United States, frankly. So the effectiveness is developed, is seen over time.
Thank you.
Elizabeth Witt, any final questions?
No, I'm good.
And Patrick Butler.
Oh, thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Just thanks for joining us today. First and foremost, I'd like to wish anyone in our jurisdiction or elsewhere who's suffering from COVID-19 a speedy recovery and the best to them and their families. But I'd also like to take a moment and just echo Dr. Fitzgerald's comments to the youth of our province. You are an extra layer that can help stop the spread of COVID-19, like the masks, like the social distancing. If you take charge, as you have on so many important issues in our province and have shown real leadership, you can also show real leadership here in helping curb the spread by following public health guidelines. And so please step up once again and show the capacity that you have in leading this province to safety. So at that, I'll say please look after yourselves, each other, and together we will get through this.
Thank you, Premier. Thank you, everyone. Enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading